all your after photos look fake. The legs are always paler. Oh man, what's going on? My name is Dr. Jack Bulat. I'm a double board certified physician and vein specialist. And today we're gonna be answering common questions from you guys about vein disease, spider veins, varicose veins, so on and so forth. At Maddie.k, what even are spider veins? Spider veins are tiny, tiny little fragile looking veins at the surface of skin, and they're called spider veins because they resemble a spider's web. Now, why do they occur? Part of it can be just people get them a little bit over time as we all get a little bit older. But if somebody has a lot of spider veins and they're sort of in these large clusters and webs all around your thighs or your calves, it could be because of underlying vein disease. So when you have vein disease, it comes from valves in your veins not working correctly. What does that mean? To get blood from your feet back up to your heart, your body relies on valves in your veins that act as one-way doors. They let blood go up from the feet to the heart, and then if the blood wants to go back down because gravity is pulling everything down, they shut closed. Over time, the valves start misbehaving. They don't work correctly. And so there's leakiness of blood back to your feet because of gravity. The way your body reacts to that issue over time happens in a couple ways. So you can get cramping, swelling, and so on and so forth. The other way that your body responds to that pressure in those veins is by sprouting new veins. Abnormal veins that kind of shouldn't be there to begin with, but they form because of the pressure. All right, so at Life with Sheila asks, can crossing your legs cause varicose veins? The short answer is no. We don't have any evidence for that. The long answer is that there are other risk factors for vein disease, including varicose veins. So genetics does play a pretty big role, okay? So if your parents, at least one parent, had vein disease or it runs in the family, you're already at 50% risk of getting it. If both parents have it, then the risk is even higher. So there are other risk factors too, and there is definitely evidence for these having more of a role and causing vein disease. If you have one or more of these risk factors, whether or not you cross your legs makes very little difference because you already have those other more important risk factors. If you don't have any risk factors, don't worry about it. Cross your legs, you'll be okay. At Mia_H84 asks, is it safe to massage varicose veins? Yeah, it is. You know, sometimes what happens is varicose veins can be painful or uncomfortable. It is safe to gently massage them. So massaging in itself is not going to hurt anything. The only exception to that is, if you notice that the skin around the varicose vein is really, really thin, or if there's been injury and there's an ulcer, then I would recommend not touching it. I would recommend cleaning it. I would recommend bandaging it. And most importantly, go see a vein specialist, because if you have a venous ulcer, it's time for you and me to talk, okay? So, but massaging varicose veins by itself is not really gonna do much harm at all. At mdanielle_s asks, what are the red flags for vein disease? By red flags, I sort of take it as things like signs and symptoms that it might be vein disease. Number one, spider veins. Now, if you have a couple here and there, it may or may not be related to vein disease. But if you have clusters or these sorts of wave-like distributions of spider veins, that could be related to vein disease. The other one is varicose veins. So these are kind of bigger, ropier looking veins. If you have them, that also could be related to vein disease. Those are the two main signs that we think about. Now, when it comes to symptoms, there can be a bunch, and some of them are quite subtle. Most patients report leg cramps, especially at the end of the day. They report swelling or heaviness. Sometimes they report that they feel like they need to keep moving their legs at night, and they have trouble falling asleep, like they have what's called restless leg syndrome. If these symptoms are improved or get better when you raise your legs up against the wall or prop your legs up with a pillow and then they feel better, that's a pretty good sign that it could be coming from veins and that the symptoms that you're experiencing might be related to vein disease. Same thing with wearing compression socks. Compression stockings are a good way to manage certain symptoms from vein disease. They don't cure the problem. They only work while the stocking is on. But if you feel better with the stocking on and you're like, oh, my legs feel better. They don't feel as heavy. They don't feel as crampy. that's a pretty good sign that what you're experiencing is coming from vein disease. At EMJ04, why do veins look blue-green from the outside, but red when you extract blood from the same vein? I love this question because it's sort of, I can't help but get super nerdy about it. Everything that we see, we can see it because there's light that comes from somewhere else, hits that thing, and is reflected back to us, right? When you look at veins through skin, the warmer hues, the reds and yellows and oranges, they're refracted away from you and they don't reach your eyeball. But when you actually, say, cut open a vein, not that I encourage this, and you look at the blood, there's no tissue between the light that's coming from the blood and being reflected back at your eyeball and your eyeball. And so you see all the colors, and so those warmer hues are now more visible to your eyeball. And so you see it. So there you go. At Nana Naomi 1956 asks, are painfully itchy legs when my heart rate goes up a symptom? By itself, the itchiness might not be related to veins, but that said, if you have other symptoms, such as swelling, cramping, heaviness, and especially if those symptoms improve when you're walking around more and when you are lifting your legs up against the wall, or if you're wearing compression stockings, then it might be related. But if it seems to kind of not track with those symptoms, I would say it might be something else too. The best thing to do is to go see your doctor, explain your symptoms, and they may make a decision to say, hey, this is related to something else because of other stuff that we found, or, it may just actually be related to veins. In which case, if you have some of the other symptoms especially, come and see me, and we'll look at it together. At Jackie in Motion asks, are random painless leg bruises associated with poor circulation or varicose veins? Bruising by itself may not be related to vein disease. If it's a repeated concern or if the bruises are really severe, it could be related to something else. For example, issues with blood clotting or easy bleeding, and you may want to talk to your doctor. If the bleeding and bruising is right on top of a very, very big varicose vein that's otherwise also painful, and you're starting to see that the skin is getting really thin around that area, then it might be related to vein disease. But otherwise, if there's nothing else, like spider veins or varicose veins especially, or swelling, and there are no other symptoms, might not be related. At Just Layla asks, will treating veins in my 20s make my deep veins work harder and possibly incompetent when I'm older? All right, Lilia, this is a good question. Whenever we think about treating anything, we have to think about the pros and cons, right? The costs and benefits. Vein treatment closes the veins that are not really all that important and reroutes blood into the deeper, healthier veins. Vein treatments alone are not going to significantly increase how hard your deeper veins have to work. Your deep veins are able to accommodate us treating your other veins just fine. And the other thing that I'll say is if you don't treat your veins, you can have a lot of pain and other symptoms that can make it harder to continue to exercise, sustain a healthy lifestyle, and so on and so forth. And you may be buying yourself other issues in the long run too. It doesn't hurt to see a vein specialist and talk about your veins and what the options are, even when you're in your 20s, because it is chronic and so it tends to progress over time. So talk to a specialist, weigh the risks and benefits, make sure you talk to a doctor about any other conditions that are happening, and come up with a treatment plan together. And I would say that's the best strategy. At Dylan F04 asks, is laser the best option for vein treatment? The first kind of laser is essentially called endovenous laser therapy, or EVLT. The treatments can be a little bit painful and the recovery is a little bit more prolonged than some of the other treatments that are offered. Now, aside from EVLT, there is blue light therapy or laser that's offered at spas or aesthetics practices and so on that don't involve shining laser inside of the vein or using laser inside of the vein, but using laser on skin. That treatment is used for treating small veins of the face and feet when some of the other treatments can be riskier. But I'll say this, they're generally less effective. You need multiple sessions, many sessions to get the kind of outcome you want, and they can be really, really expensive treatments. So before deciding that laser is going to be your jam and that's what you're going to do for your veins, come and see a vein specialist to get a full evaluation, talk about all treatment options and which treatment options might be the best choice for your situation. At Red Scarlet XO asks, why would you want veins to close? Don't you need them? So there are different kinds of veins in your legs and feet. There are broadly superficial veins. Those are the ones that tend to act up and cause vein disease. And then there are the deep veins, and those are really, really important, and you absolutely need them. Now, when it comes to the superficial veins, they carry only a small fraction of blood back to your heart. And at some point, especially when they start to get leaky and have vein disease, they start to be more trouble than they're worth, honestly. And so, to your point, we close those veins, and that's how we treat vein disease. The blood gets rerouted to the deeper and healthier veins, and those veins are able to accommodate that. Treating those superficial veins for vein disease, think about the benefits and costs. So if the costs are pretty low because your body is able to function just fine without them, then the benefit of treating those veins can be substantial, because not treating it can lead to complications, and you would be letting vein disease run its course. At the end of the day, if you have leaky valves in those veins and you have symptoms and it's affecting you substantially, then it is totally okay to close those veins and your body will adjust. At Brenda58 asks, if you are on blood thinners, can you do this type of treatment? Short answer is, yes, you can. Being on blood thinners by itself doesn't mean you cannot get treated. The longer answer, or the caveat there, is I, as a vein specialist, would want to know why you're on blood thinners. There could be lots of different reasons. And sometimes the fact that the patient is taking the blood thinner, like why is that, can cause problems when it comes to treating vein disease. So it's really depends on the reason why you're taking the blood thinner to begin with, rather than whether or not you're on one. At Riley Pop asks, is there any natural treatment for varicose veins? It's a great question, Riley Pop. And don't we all wish that there was a magic ointment or some kind of an herb or some supplement that you could take in order to treat your varicose veins? I hate to disappoint. Unfortunately, we've looked at lots of different remedies and we just don't have evidence for them being effective for treating vein disease. The reason for why that's true has to do with what causes vein disease to begin with. Vein disease, including varicose veins, happens because the tiny valves, one-way valves in your veins that are all along the vein, they start to not work correctly. Applying an ointment or taking a supplement doesn't really do anything for managing those valves, which are already not functioning correctly. And so at that point, what you're looking at is, if you want to treat your veins, come see a vein specialist, get scanned, we'll see what veins are acting up, we'll talk about treatment options. And by the way, these treatment options are minimally invasive, really convenient, they have very little recovery and downtime, and they're highly, highly effective, and we do have evidence for that. At J.Love asks, all your after photos look fake. The legs are always paler. Oh man, what's going on? All right, Jay, you caught us. So here's the long story. When we see our patients and we talk to them about how to treat their veins, we also tell them that certain treatments, you can have side effects with sun exposure. And so a lot of our patients, especially the ones that are most diligent about doing the right thing after vein treatment and making sure that the treatment is as effective as possible, will avoid the sun for at least 6 weeks after treatment. And so there goes the explanation. The legs are paler. Don't get me wrong, it is true. But the reason why they are is because our patients are good and compliant about what to do after vein treatment, as we want them to. And they feel better. So if you have veins, if you have issues, come and see us. We'll take a look. We'll treat you. Your legs might look paler, but once you're all good and done and your veins are great and your legs feel better, you can enjoy the summer and show off those great looking legs and get a tan. All right, so that's a wrap for questions from you guys for now. Keep those questions coming. And again, I hope that this was helpful and informative. At the end of the day, if some of the stuff that I talked about resonates with you and you're concerned that you may have vein disease and the pesky veins are bothering you, come and see us. More than happy to see you, get you scanned, check your veins, talk about treatments. My main goal is just to make you guys feel better. It's such a great quality of life improvement. All right, until next time.